Maybe you're a procrastinator. Maybe you're drinking too much. Maybe you're having panic attacks every day. Maybe you are not managing well at work. The therapist in that approach would help you. So for someone who has never been to therapy before, what are some of the things that can be helpful for you as you begin your search for a therapist? And so what I want to do today is to talk about when you're looking for therapy, what are some of the things to think about? So one, there are two main approaches to therapy, I would say. One approach is where the therapist will help you look at past experiences and help you to make connections on how those past experiences have affected your current behavior patterns, your current relationship patterns. The idea there is that as you make those connections between the past experiences and your patterns today, your insight and your awareness will be increasing. And that insight and awareness, new insight, new awareness, lots of light bulbs going off, will help you make the changes that you've been wanting to make. That's the rationale. The other main approach is where the therapist will be helping you with specific strategies and tools to help you manage day-to-day problematic emotions, problematic behaviors, maybe some habits that you are looking to change. Maybe you're a procrastinator. Maybe you're drinking too much. Maybe you're having panic attacks every day. Maybe you are not managing well at work. The therapist in that approach would help you look at what your goals are, what are the habits you're trying to change, what are the behaviors you're trying to change, what are the emotions that are problematic for you. We're going to help you with strategies, and then every week we'll be checking in, like, are you making progress with practicing those strategies? Are there obstacles to practicing the strategies? Do we need to change the strategies? And typically in the field, that approach is usually considered more of a short-term approach. It's more structured, more practical, and more specific to one thing you're looking to change, like a specific thing. I'd like to drink less. Oftentimes, it's really important because of the way we are built as humans that we've all had childhood experiences. We've all had experiences in every stage of our lives that are brilliant and light and beautiful, but we've also all had dark moments, right? Things that happened to us that were unexpected, that were not comfortable, and sometimes it's extreme. Those things might have been traumatic, like the loss of a loved one, like being physically assaulted, like witnessing a violent incident, a parent dying when you were young, any number of things that you could have experienced that would have left you with some kind of effect. And the process of therapy would help you make the connection. Oh, this is how that thing affected me, and here it is how it has affected my behavior today. Here's how it has affected my thinking today. Here's how it has affected my relationships today. And so I would say that most therapists practice a combination of those two approaches, at least in New York, where I have done most of my professional work. Some therapists may focus more on one approach versus the other, but most therapists practice a combination of those two approaches, right? I was trained mostly in the early experiences approach, where the therapist is really looking at those past experiences and how those influence you. But prior to my graduate school experience, I worked for several years as a case manager in the New York City shelter system. So, helping people who had a mental illness, who also had a substance use, alcohol or substance use problem, helping them find housing, treatment, remaining stable, maintaining their stability. And so from that experience, I really also very much admire and appreciate, and I think it's equally valuable, the other approach, which I was not formally taught, right? So the approach where the therapist is helping you with specific strategies to manage emotions and behavior day to day. And what we know is that the thing that's most associated with good outcomes in therapy is the relationship you have with the therapist.